Hi, my name is Dr. Misbah Khan. I specialize in revision surgeries, in particular related to skin and soft tissue. Today I'm just going to go over some of the questions that I've been getting via emails and also people inquiring through Reels. So I figured I'll put together a small YouTube video to answer some of your frequently asked questions. So I'm sure that it's not covering each and every question, but those are the few top 10 that I figured would be helpful for anybody who is seeking a revision surgery with me. First and foremost question that I get asked is that, can my problems be fixed? Now, 90% of the time I can tell you right off the bat that the defects can be made better. Whether it is because of a skin and soft tissue surgery in the past, it is because of the liposuction, is it because of fat grafting, the defects can definitely be improved upon. They can be made better. Can it be fixed to the point where it used to be before you got the surgery, like 100% reversal? That is really hard to tell without definitely having a detailed consultation with you, and depending upon the kind of defects that you have. I can't say that I have never been able to correct somebody to 100% of the way they used to be. I have, but it can happen, but it's not always the norm. Usually we're able to make the situation better to the point where it is acceptable by the patients and they're happy with it, but we cannot, for the most part, we cannot reverse it like 100% the way it used to be. So just please know that. Okay, and then is it going to be one revision surgery, or will I require multiple procedures? So that's a very good question. That depends upon, again, the type of defect that you have. In some cases, one surgery is enough, but most of the time I prepare my patients that more than one surgery might be required. Now, you may get better with just the surgery alone, and you may not need anything else afterwards. Maybe we could do just like a minor correction with either the help of a fractionated CO2 laser. We can remove some of the scarring, or we can improve upon the skin texture somehow if that's the case, or minor adjustments can be made with the help of a filler, perhaps a minor fat grafting session or whatnot. So it may not be like a completely the way that it used to be the first surgery was supposed to be. It may not be a complete just like that, but minor corrections can be required, and so just be mindful of that. Now, the other questions are that, are revision surgeries expensive? Yes, they are. Doing the surgery in the first place is actually always going to be more economical and cost effective for you. And if it's done the way you intended it to be, great, good for you. But sometimes, the outcomes are not as desirable, and then you have to go back and fix it. That actually is always going to be more expensive than the surgery in the first place. So just be aware of it. Because you're not dealing with the tissue in its native form. Now you have defects, you have areas that were underdone, you have the areas that were overdone, then you may have some scarring in addition to it, and some of the things that may have left a mark or a scar or whatever that may not be completely reversible. So just know that you're dealing with a tissue that has already been operated upon, and anatomy changes and things that change. So that's why revision surgeries are always going to be more expensive than the original surgery in its first place. Now, is there a fee for consultation? I charge for my consultation. I think that my opinion is important and is valuable, and the consultation visits are usually about anywhere from 45 minutes to about an hour. I usually just sit down with the patient and go through all of their concerns, whatever they have, important concerns, photos, come up with a plan, and to see how we can accomplish it, go over important questions like the way we're talking about it right now in this video, but also to answer your question if more than one surgery is required, and how to pan it all out, how to plan those surgeries, and if the patients are coming from overseas or if they are local, then the things can change depending upon also your lifestyle and where you're coming from. So all of those questions, they have to be answered during the consultation. And I strongly believe that you get what you pay for in terms of like your healthcare and your advice and whatnot. If somebody is, their doctors also do free consultations, and that's okay. That there's nothing wrong with it. It's just that it's my style that I do charge for my consultation. So whenever you're coming in, please let us know if you will be coming in for a consult so that we can discuss the consultation fee. Okay. And do we offer any funding or payment plans? We do not. Currently, we have no plans of implementing a payment plan for the patients, so all the payments are due on the date of service. And so just be mindful of it. Sometimes patients, they use more than one credit card, which is fine with me, no problem. Sometimes patients will pay by check or by cash. Either way, it's fine. We can make it happen for you. I usually tell my patients to just like maybe they can use a card that will give them a lot of points if they make a big purchase. So that may not be a bad idea to use those kinds of cards. We accept all major credit cards, and so just know that all payments are due at the time of service. How soon can I resume my daily routine activities? Now, that's a very good question. Everybody, they have a life, so you cannot tell them that you cannot do certain things for an extended period of time. Most of my patients are able to get back into the routine in a couple of days. Now, if the surgery requires fat grafting, if the surgery is limited to the head and neck area, then I might have to extend that period up to about a week, or in some cases up to 2 weeks. It depends, because in order for you to get the good outcome, sometimes activity is okay and sometimes activity is not okay. So it's case by case. So you just have to let me know what your daily requirements are, or what things that you can and cannot do in terms of your post-op care, and then we can work around it, and then we can go over the restrictions of your daily activity accordingly. All right, and what if I cannot keep up with the post-procedure instructions? Post-procedure instructions are very, very important in order to have a good outcome. You have to be respectful of the fact that this is not your first time that you're going through it. This is probably your second, third, or in some cases even fourth or the fifth time that you're undergoing this procedure. You want to make sure you get the best out of it. And in order to get the best out of it, you have to follow the post-procedure instructions. That's number one. And number two, definitely come back for your follow-up. We want to make sure that things are healing accordingly and that you are satisfied with the outcome in the end. And if that's not the case, then you may be unpleasantly surprised. Now, what are the options for anesthesia? In my office, we can do under local as well as under deep sedation. So I have a fully certified OR, certified by the AAAHC, and we have the anesthesiologist who can come in and put you to deep sleep, and you will feel absolutely nothing. By the time you wake up, it will be all over. And the recovery from the deep sedation usually takes about a day or two to get recover from all the drugs that they have to give you to put you to sleep. But other than that, it's a pretty quick recovery. Now, some patients, they specifically prefer to undergo local anesthesia so that they are awake and they see how things are happening and whatnot, and that's fine too. So we could do it under local, or we could do it under deep sedation. You just have to let us know. And in some cases, I will recommend that patients, they undergo deep sedation because they may have so much scarring that it will be difficult to completely numb the area where we are working on, because it may be very painful for them. And there are certain procedures where I recommend that they do definitely undergo deep sedation anyway, because there's no other way around it. So that again depends upon patient by patient, and if it's your preferred choice is to be under either or, you just have to let us know. How soon will I see the results? Revisions usually are variable. They depend. It can take anywhere from 6 to 8 weeks, and in some cases up to 12 weeks. So I may have to talk to you about it depending upon what we're doing for you, especially if there are going to be more than one surgery involved. Then it can prolong in terms of how soon you will be able to see the results. So, but just run it by me in terms of like if you have like a vacation or something planned, or an event that you have to be at after the procedure, so we can time it accordingly, and it's enough time for you to be able to see the results and enjoy them at the same time. Okay, and how soon can I get my revision surgery after the initial surgery? That question gets asked all the time. Usually I recommend that you should definitely wait for 3 to 6 months. My first recommendation to all patients who are seeking revisions is to definitely talk to your surgeon who did the surgery in the initial, the first surgery for you, and discuss your concerns with them. In many cases, the doctors will definitely cooperate with you, and they will do the best they can to give you the most optimum outcome. And in some cases, when it's not their field, or they don't feel comfortable, or there is a problem or whatever, and if you want to have revisions done by me, then definitely wait for about 3 to 6 months out. You can have a consultation at a 3-month mark or a 4-month mark, depending, and then we can do the surgery. Either if you're ready for it, then we can do it right away, but if not, then we will ask you to wait for another couple of months, and then you can come back. But usually at the end of 6 months, what you see is what you will get. There's not much change that happens after the 6-month mark. So just know that, whatever surgeries that I do in my office, there is nobody else who's going to be touching the patients, okay? There's not another doctor who will be working on it. It will be just by myself, and me, my nurse, and the anesthesiologist will be the only people who will be working on you. And the entire surgery is done by me. Usually I book only one revision case whenever I am doing that surgery on a particular day. I do not necessarily book like 3 or 4 cases in a day, because revisions can be very can be very long. You never know. Sometimes I finish way before time that I anticipated, and sometimes it can take a little longer than I anticipated. So it could go either way. And many times you don't know exactly how long it can take. So I try to just give the patient whatever they are asking for in that particular time that they are here, and to make sure that the case is done before they leave. If they're awake, they will be able to see the results right away. If they're under deep sedation, then give and take another few days or so, they will wait and they will start to see the results happening. But either way, the goal is to make sure that whatever the patient is here for in my office, in the OR on that day, that goal is achieved to the maximum ability that I possibly can. And for those reasons, the revisions can be very long, and they can also be expensive at the same time. So I hope this video was helpful for you, and I'm sure that there are other questions as well in your mind. So if you do have additional questions, feel free to, you can always email me. You can also let me know, and I'm happy to see you for a consultation. We can go over specific questions that may be pertinent to your situation, and hopefully we'll be able to answer